Good day, fellow Kenyan. Today I was watching the daily briefing by the CS Minister of Health, the Honorable Mutahi Kagwe, and he announced that so far the country has recorded over 23,000 cases of COVID-19. This is not a good show. It's not a good figure. It's nothing to celebrate. It's something that we should be concerned about as Kenyans. And he says the Minister of Health is projecting that by the end of this month, which is August, to early September, we're going to be at the peak of the numbers of the COVID-19. The numbers are going to soar by the end of this month towards early September. It's not good. It's not something that we should smile about. The reason why I'm saying this is Kenyans no longer take serious the advisory or the protocols that the government has put in place to help the curbing of the spread of this disease. For instance, I was in Western, my rural home, and I could see people going about their daily lives just like COVID doesn't exist. I walked on the streets of Kakamega, I walked to the streets of Bungoma, I walked to the streets of Webuye, I went up to Busia, I went up to Vihiga, Mbale, Luanda, Chavakali. People are not wearing masks. It's like a face mask has become an alien to them. Yet a face mask can help you prevent the spread of the disease and contracting the disease. Now, I spoke to one of the people that I met in Bungoma town and I asked them, how come you're not in a face mask? And the answer was, hii kitu haiko. Now, that was a careless response. It was a careless answer to this question. Then I realized that ignorance among our people is going to kill us. It's not about the dangers that we face in the face of COVID-19, but it's about the ignorance that we have that will make us contract this disease. That's not good. Then I went to Eldoret town and I was impressed. County council askaris and even police officers have instructions that anybody without a face mask should be treated like a criminal. Indeed, that is good. Because 9 out of 10 people that you meet in the streets of Eldoret are wearing face masks. It's because of the commitment by the governor of that county of Uasin Gishu, Mr. Jackson Mandago. He has made it clear that anybody without a mask should not be allowed to walk on the streets of Eldoret town. Other counties, like the western counties, no longer take this thing serious. We only talk about it, but we don't want to enforce it. Now, as we continue like this, and as the CS keeps saying, if we treat this disease normally, it's going to treat us abnormally. It's incumbent upon us to ensure that we adhere to the protocols, the stringent measures that the Minister of Health and the government of Kenya and the World Health Organization have put in place to ensure that we stop the spread of coronavirus. Some Kenyans treat this thing normally because of what they see on television from the neighboring countries like Tanzania, which have declared their countries corona-free. In Kenya, we have these cases. We have seen people succumb to this COVID-19 disease. We have seen people buried as a result of COVID-19. Yet we keep asking ourselves, umeona wapi mtu mwenye ako na corona? You never know the person next to you if they are working with this disease or not. You may not know until it brings them down. However, I was also astonished when I saw people not taking lightly. You know, initially when the first victim of COVID-19 was announced in Kenya on 13th of March this year, people were very cautious, people were very responsible on how they conducted themselves in public. And they could stick, or rather glue, on their television sets to watch the daily briefings by the CS and his two deputies. Nowadays, nobody bothers, nobody cares, nobody watches, nobody considers these daily briefings as anything. Maybe Kenyans are fatigued, but coronavirus has not been fatigued. It continues to strike. It continues to infect many people. And we are losing people. We are losing lives. Now, what can we do as a citizenry of this country? We need to take care of ourselves. Remember, your health comes first. Afya yako ni muhimu sana kuliko mambo mengine. Usiseme tu bora uhai. Lazima tuwe wenye afya nzuri. Kwa hivyo mimi nawaambia ni wenzangu, let us not take this thing lightly. Tusiwe walegevu na tusiwe wenye kubishana mara kwa mara tunapoambiwa kwamba ugonjwa huu au ugonjwa hili la corona lipo. And I would urge the leaders, especially political leaders, to always ensure that whenever they go meeting people, talk to them on the need to have face masks. I know most people live below $1 a day, and politicians, you are leaders. Lead by example. If you lay your hands on 1,000 face masks, I know you can afford. Please make sure you share with your people. Make sure you have your people have these face masks. It's important. And also talk to them, because I think Kenyans lack what you call civic education. Not so many people can afford to watch a television, or not so many people have access to radio. So they don't listen or they don't watch the CS for Health and his two deputies, Madam Agnes Mwangangi, Dr. Agnes Mwangangi, and Dr. Rashid Amana, and Dr. Patrick Amoth, the DG Medical Services. So, politicians and other leaders, local administrators, make it your commitment to provide civic education so that we can flatten the curve as a nation. Let us fear this virus. Let us not take it lightly. My plea to you, my plea to fellow Kenyans, let us not take this disease lightly. Tujihadhari, tujichunge, ili tuweze kuishi maisha marefu. Tunahitajiana katika dunia hii. Tusiwe wepesi wa kupuuza mambo. Asanteni.